So it's an interesting thing nowadays. What we have available with ARV is just a generic abbreviation for antiretroviral. So what we have available these days are really potent medications to shut down HIV replication. And what we know now is that these medications reduce the virus load to undetectable. What that means is that it reduces the risk of unprotected sex causing transmission of the virus to extremely low levels, but it's not zero. And that's part of how we now have some couples that may be HIV positive even having children of their own, and the children not getting infected, the baby's not getting infected. It's because we can suppress the virus so much that it doesn't.
How long is this?
Not enough around to infect other people.
How long has this been on the market? Because the last, to be perfectly blunt about it, I don't keep up with HIV research. The last thing I remember is reading about the HIV cocktail, which was about 30 or 35 drugs, pills 6 times a day. How often do you take this? What's the treatment now?
So the new treatments are actually very good. For most adults, they can be on a single pill once a day and suppress the virus to undetectable levels. That single pill has a combination of either 3 or 4 different medications in it that work as that cocktail. So it's a cocktail all in one pill.
Charlie said he takes 4 pills a day. Is that something different, or is it kind of a different variation?
There are still numerous different combinations of medications that can be used, and that often depends on the particular virus that is found in a patient. So now, before we start treatment, we actually do a genetic study of the HIV virus to know which medications it will respond to.
Side effects. How's about you had said that ARV is a generic term. Is it a generic drug? What are the general side effects, if any?
So in terms of side effects compared to 15 or 20 years ago, when there used to be an awful lot of nausea and GI issues associated with these medications, now very, very few side effects. And that's also helped keep compliance with the medications quite good. And so as long as a patient takes their medicine every day, what we know now is their life expectancy can be absolutely normal compared to all the rest of us.
Let's talk about the HIV diagnosis a little bit. Last time you and I talked, it was increasing among women. African American numbers were still going up. Where are we on the diagnosis of positive HIV?
Sure. So that is true that the numbers are still creeping up, especially in women of color. That includes African American and Hispanic women, and still the predominant group with HIV is men who have sex with men. That group its numbers are reducing overall as a proportion of the HIV cases. The diagnosis now, we are able to make the diagnosis very early after infection. It used to be there was a window period of up to a few months, and then that was reduced to about a month. Now the new testing has a window period of less than 10 days between infection and the ability to make the diagnosis. And that type of test, the newer test, is being used at our hospital and other hospitals in the state.
Anything new on transmission?
Transmission, we've known for years. The transmission occurs really by only 4 bodily fluids, the male and female sexual secretions, as well as breast milk and blood. And really not a whole lot new in terms of transmission. Part of what we're doing now is, with closing that window period on diagnosis, trying to prevent transmissions from happening by treating patients earlier. And we're also, with those genetic studies we do before we start medications, the reason we're doing that is because some of the strains that are being transmitted are actually resistant to some of the medications.
Dr. John, one more question about the ARV, the drug that people are taking. Sort of a two-pronged question. A, what is the cost of that as compared to previous HIV drugs, which was, like $30,000 and $40,000 a year? And Secondly, sort of related to that, with AIDS, with HIV being epidemic in third world countries, specifically Africa, is the cost of this ARV such that it would be more accessible in the parts of the world where it's still dangerous?
So there's good news on both fronts. The cost of medications in the United States has come down dramatically, and in most cases that's less than $1,000 a month. The government assistance program, called the AIDS Drug Assistance Program, provides medications to anyone with HIV who can't afford them or doesn't have insurance coverage to pay for those medications. And so medications now in the United States are more available than they've ever been. And with better drugs, safer drugs, and availability, we believe we're now beginning to impact and slow down the transmission of the virus. Seeing even in our area new infections in teenagers and young adults more commonly than any other group. And that's a difficult group to work with. And so we'd like to get the word out. Be proactive. Be safe as safe as you can if you're going to engage in risky activities. Second question: in other parts of the world, how much drugs are available? More and more antiretrovirals are available worldwide, especially in underdeveloped countries, and the cost has come down dramatically. Most of the pharmaceutical companies have reduced their prices, and now a lot of medications are available in generics that helps bring the price even further down. And so for most patients in underdeveloped countries, they have access to medications either free or at somewhere around $1 to $2 or $3 a day. It's still an awful lot of money when 50% of those people make less than $1 a day.
Yeah.
But the prices are coming down dramatically, have come down over the past few years.